Are you frustrated with the rising cost of your company's health insurance, but feel powerless to control it? Do you feel like you're throwing money into a system that doesn't give you the clarity that you need to make real improvements? For most employers, health insurance is one of the top three expenses, yet few realize how much control they have or can have with the right strategies and tools. Health insurance is an expense you can manage. What if your group health plan wasn't just a necessary expense? What if it could become a powerful tool for optimizing your costs and driving employee satisfaction? What if you were able to integrate better inputs into your health plan that would not only improve your employees' experience, but also help in lowering the plan spend to drive premiums lower as the output? The secret to this transformation is data, and we're here to show you exactly how it works. Let's talk about how today's savvy mid-sized businesses are transforming their approach to managing this expense with the right data. We believe that the answers to the question of how to better manage your spend lie within the claims data. Claims data includes the detailed costs of outpatient services, inpatient care, imaging, labs, prescription drugs, all the components that make up your plan's expense. If we look at your health plan as a simple math problem, we can deduce it down to this equation. Premiums equal cost of care plus cost of administration plus cost of reinsurance. Three simple factors equal your premiums. By analyzing this data, you can identify opportunities to lower the inputs, which ultimately reduces your overall spend while improving plan efficiency. Think of this just like any other budget. When you know where your money goes, you can begin to better plan and prepare for the future. So where does the money go? Have you ever wondered where all of your plan's money goes? If you're fully insured, likely so, because you've never seen the data. If you're level funded or self-funded, you may already know a little bit. According to HCCI's most recent healthcare cost and utilization report, as shown here on the screen, the distribution of per person spending in employer-sponsored health insurance plans is 31% to professional services, 28% to outpatient services, 23% to prescription drugs, and then 17% to inpatient services. Now, this is just a general benchmark, and again, this is from the HCCI report. This is from 2022. The latest report hasn't been published since. So, if your annual claim spend is $1 million, this means that about 31% or $310,000 is going towards professional services, such as physicians, labs, therapy, mental health, and more. Imaging and labs alone can account for 10 to 15% of your spend. Collectively, these categories will represent the lion's share of your total spend, but they also represent opportunities for significant savings. Let's talk about how employers are gaining access to claims data. Fully insured plans often leave employers guessing without detailed data to take meaningful action. It's like trying to budget without knowing your expense. Switching to a level funded or a self-funded plan doesn't just offer transparency, it empowers you to tailor cost saving strategies unique to your business. By transitioning to a self-funded or a level funded plan, employers gain access to robust claims data that allows you to uncover trends and opportunities. These funding models also provide more flexibility to implement cost saving strategies tailored specifically to your population. Let's look at some examples of employers using claims data strategically. How about a manufacturing company that identified high claims related to repetitive RX prescriptions? They implemented an independent PBM with a specialty drug sourcing program and reduced their cost by $17,900 annually. A large C-store operator identified a higher than normal utilization of imaging and labs, and they were able to implement a direct contract through Quest Select and Green Imaging, saving them hundreds of dollars per visit across hundreds of members while eliminating out-of-pocket cost share for their employees. Savvy employers are using claims analysis to negotiate better renewals with their carriers as well. In one instance, a label manufacturer was able to negotiate a 16% decrease on their renewal with the claims data that they had. These employers didn't simply cut costs. They improved the overall value and they improved the overall perception of the health plan for their employees. There's many ways to get there. Self-funding can sound risky, but don't let that deter you. These employers put in place a 5-year roadmap. You don't have to land the plane today. There's things that you can do and there's strategies that you can implement starting today where you're at. I encourage you to reach out to us. Let us help you build a 5-year roadmap to help you get to where you want to be with your health plan.